Perfect. Hi everyone. As Michael said, my name is Ciara. I'm a dentist. I'm delighted to see that poll that 80% of people have already talked to their dentists about HHT. That's really encouraging. So that's brilliant. Just to introduce myself a little bit first, I'm from Mayo, as everyone from Mayo will tell you within about 5 minutes of meeting you. I studied dentistry at Trinity College in Dublin, and to be honest, HHT was not something that was ever really emphasized to us as students. It's not something that I remember there being an emphasis on as a condition that's relevant to dentistry. So it wasn't really until I met Dara, I think in 2015, that I learned more about it and how it can be relevant to dentistry. But hopefully that's something that will change in the future. I graduated from college in 2011, so I've been working in dental practice for 11 years now. I love my job. A lot of people ask me how I look at teeth all day, but it is actually a lovely job. Outside of dentistry, I love to travel. So on a few occasions, I've been lucky enough to combine the two by doing some dental volunteer trips. I always sicken people making them look at photos of this, but this here on the left is my most recent volunteer trip to Haiti, and this is my mobile dental clinic, which I used to wheel around to wherever was needed. And here on the top right, you'll see one morning myself and my nurse Olga arrived to the clinic, and this was the queue that was waiting for us at 7:30 in the morning. So anytime I'm having a stressful day in work in the clinic in Swords, I always remember this morning and think, oh, it's not so bad. Unfortunately, as the day went on, that queue didn't get any smaller. It just continued to get bigger and bigger. Anyway, let's get on to what we're here to talk about, which is HHT and how the dentist can be relevant or have a role in HHT. The first way that a dentist can have a role in HHT is obviously with diagnosis. And as we all know, HHT is an underdiagnosed condition, unfortunately. Most patients with HHT develop telangiectasias, as Niamh said earlier, on the skin, hands, face, and inside of the mouth as well. So that's an area that is obviously very visible during the dental visit. If a dentist notices a telangiectasia maybe in the mouth, they might ask you about other symptoms relevant to HHT, like nosebleeds or things like that. And then if they feel it's necessary, they might arrange for a referral for diagnosis and treatment. Obviously, the key here is that if something is spotted early, that it would hopefully or might prevent the risk of serious health outcomes in the future. And then that hopefully that other family members even might end up being diagnosed down the line. So that's the first point. These are these oral telangiectasias. I know Dr. Niamh had some pictures of them earlier as well, but this is what they look like. They're small red spots, and they can be raised or they can be flat. They are prone to bleeding, so it can be useful to avoid very hard, very spicy or very hot foods to prevent aggravating them. It's also a really good idea to use a soft toothbrush just to prevent damaging them as well. I recommend a soft toothbrush to all of my patients anyway, so that's a good idea for everyone. So that's how the dentist can kind of have a role in diagnosing HHT. But next I want to get on to how dental treatment is slightly different if you have HHT. Any dental treatment has the potential to cause what we call a bacteremia, and essentially bacteremia is when bacteria get into the bloodstream. More than 40% of patients with HHT will develop what are called pulmonary arteriovenous malformations, which is essentially just a malformation within the lung. And patients who have these lung malformations are then again more likely to develop a brain abscess. This little diagram here, I think, can be helpful to realize or to associate how the three are linked. So let's say here, top left, we're doing some dental treatment, and some bacteria from the mouth ends up in the bloodstream. I know Niamh had a better picture of this earlier, but this is what a normal blood vessel formation looks like on the top, and that's two different types of AVMs on the bottom there. So as you can imagine, if there's bacteria in the bloodstream, it's much more difficult for them to get through your system in a normal blood vessel configuration than it is with an AVM. It's very easy for bacteria to pass through here. So if you're unlucky enough that that happens, and then unlucky enough again that it ends up making its way to the brain, it could, if you're unlucky, result in a brain abscess, which obviously can be quite serious. I know all that sounds a little bit scary, but we don't want to put anyone off going to the dentist or think that dental treatment should be avoided. In fact, it's really important for anyone with HHT to really try to look after their teeth well and to maintain good dental health. Any HHT patient who has a known pulmonary malformation, or anyone who hasn't been screened for lung malformations, will be given what's called antibiotic prophylaxis before dental treatment. We always err on the side of caution with this. So even if, let's say, a family member has recently been diagnosed with HHT and you're maybe waiting for a diagnosis, we probably still would give you antibiotic prophylaxis just to be on the safe side. What the antibiotic prophylaxis is essentially is just taking an antibiotic 1 hour before any dental treatment. So you'll go to your dentist for a checkup, they'll chat to you, they'll make a plan about what needs to be done, and they'll give you a prescription for some antibiotics, and you'll take that prescription to the pharmacy, and that is unfortunately at your own cost unless you have a medical card. You'll pick up that antibiotic and then you will take it 1 hour before your dental appointment. So let's say if you have an extraction booked at 10 o'clock, you'll take it at 9 o'clock, simple enough. The idea of antibiotic prophylaxis is that it reduces the risk of this bacteremia that I was talking about, and then reduces the risk of a brain abscess ultimately. So that's why we do that. So really everything I've been talking about in the last few slides is why prevention is so important for patients with HHT. By maintaining good oral health and preventing needing dental treatment, then that again lowers the risk of negative outcomes, lowers the risk of that bacteremia happening, and reduces the need for taking unnecessary courses of antibiotics. So that's the big question then. How do we do that? How do we keep our teeth healthy? How do we prevent needing to go to see the dentist? Believe it or not, I would love if everyone had a healthy mouth like this, and beautiful white teeth and no cavities and healthy gums, and all they needed was a checkup and a clean every 6 months. But unfortunately, mouths like this are unusual enough. Your oral health can be split into two groups, I suppose. So the first one is your dental health, or your tooth health. And the second is your gum health, or your periodontal health. So I'm actually going to deal with those two separately, although there are a few overlaps, but just to try and give you some tips on how to avoid having to see me too often or see your dentist too often. First one we're going to go to is how to maintain gum health. So first and most importantly is brushing your teeth twice a day for 2 minutes if you can, with a soft or an electric toothbrush. Most of us actually do that, and most of us do that pretty well. So the next bit is where people tune out, is when I start talking about flossing. Interdental cleaning is the dental word for it, but using flosses or floss, TP brushes, water flossers, there's all sorts of gadgets you can get out there now for brushing in between your teeth. It only needs to be done once a day, but people still do struggle with it. I would say 90% of patients I come across don't, when I meet them first, they don't use anything for cleaning in between their teeth, but it is really important. The thing for me that I think makes it a little bit easier is if you realize that you don't need to do it at the same time as you brush your teeth. You can do it anytime during the day. For me, if I'm trying to floss my teeth first thing in the morning, when I'm trying to get out the door, it's not going to get done, there's no time. And then if you wait until the last thing at night before you go to bed, most people are too tired. So it's all about working it into your routine. How does it work for you? So You could do it at lunchtime, when you come home in the evening, after your dinner. I personally do it when I'm sitting in the car at traffic lights. I use my TP brushes. I do get funny looks. It's not necessarily something I recommend, but that's what works for me. So that's when I do my flossing. So the next way to maintain your periodontal health is with regular dental visits and hygiene appointments as they're needed. Why regular dental visits are so important is that if something is going wrong, the dentist will spot it early. There's not a whole lot that can go very wrong in 6 months with your teeth or your gums. So if it's spotted and caught early, it's more likely that less treatment will be required. It might only be a small intervention that's needed. And then obviously, as I said, less intervention and less risk of negative outcomes then. Periodontal disease or gum disease has a lot of different factors that affect it, but smoking is one of the big ones, and that is something that is within the patient's control. So I'm sure there's lots of other reasons why a HHT patient shouldn't smoke, but gum disease is certainly one of them. And if you can avoid smoking altogether, your teeth and your gums will thank you for it. Gum disease is something that a lot of people don't really understand how it works. So I think this is a great little picture, this next one, just to kind of explain how it happens. So on the left there, you'll see a normal, healthy tooth, and you'll see that the gum around it is pink, it's not swollen, and it sits tightly up against the tooth. That's what your gum should look like. In your normal everyday life, what will happen is plaque builds up between where the tooth and the gum meet. That's the little spot that plaque will always build up. If that's brushed away within the next day, it doesn't cause any issues. But if it's left there for any longer than 24 hours, the gum underneath will start to get inflamed and will start to react to the bacteria in that plaque. And what happens then is the gum underneath gets red, it gets swollen, and if the plaque is left there for long enough, eventually what happens, the gum actually pulls away from the tooth in an attempt to get away from that bacteria almost. And then this is what gum disease looks like. It causes a pocket around the tooth. The tricky thing, once you get these pockets forming around your teeth, is that it's like a little reservoir. It's a little hiding place for bacteria and plaque and tartar. And as you can imagine, if you're just brushing your teeth, it's very difficult to clean down there. So as I said, it can be a vicious circle, and it can just get worse and worse. If you're not going to your dentist regularly to get this hard plaque cleaned off, that pocket will actually get worse and worse and eventually go down the root of the tooth, and that's how teeth end up getting loose. And often with gum disease, it can be kind of silently happening without the patient knowing it. And often by the time a patient comes to me, their complaint might be a loose tooth, but at that stage the gum might be down here even, and at that stage the tooth needs to come out. So if it's caught early, gum disease is very treatable and very preventable, but once it goes too far, unfortunately, that's when you end up losing teeth. So let's go on to the next part of dental health, which is tooth health. And if you want your teeth to look happy like this little guy here, again, same as with the gum health, you want to brush your teeth twice a day and floss once a day. The important part for your tooth health is actually your toothpaste. You want to be using a fluoride toothpaste. Most toothpaste you buy in the supermarket are fluoride toothpaste, but I can give a bit of information if anyone is confused about that. But the really important part is that you spit out your toothpaste. Don't rinse afterwards with water or mouthwash. So brush with plenty of toothpaste, spit into the sink, and then leave the taste of the toothpaste in your mouth. What that will do is it gives the good stuff in the toothpaste more time to soak into your teeth. That's how toothpaste works. If you have, let's say, a soft spot in your enamel or a weak spot, the fluoride in the toothpaste soaks into it and makes it hard again. So by rinsing out immediately after brushing your teeth, you're undoing a lot of the good of the actual toothpaste. Again, for your tooth health as well as your gum health, regular dental checkups really important. Let's say if you have a very small cavity in your tooth, that can often be filled without needing any anesthetic, so there's no risk of a bacteremia, and you wouldn't even need antibiotic prophylaxis for it. Whereas if a filling or a cavity has been left maybe for a year or two, it can get very large, and then that's when you need an injection to get it done, and you'll need antibiotic prophylaxis to get it done. So again, that's why it's important to get in as often as you can. What causes cavities in your teeth is sugar, and it's sugar in your diet, from either sugary foods or sugary drinks. With sugar, the thing a lot of people don't realize is that it's frequency of sugar rather than the amount of sugar. It's all about how often you have sugar rather than how much you have. I often use an analogy for my patients that if you were to get up in the morning and have a cup of coffee with 20 spoons of sugar in it and drank that with your breakfast, although it might be very good for the rest of your health, it's not going to give you cavities if you don't have any other sugar throughout the day. Whereas if you had maybe 5 or 6 cups of coffee during the day with a half a teaspoon of sugar in each one, and they were spread out between your meals, you probably would get a lot of cavities. So it's all about how often you have sugar rather than how much you have. So I'm just trying to think of ways that people can get in their chocolate and sweets without feeling guilty about their teeth. If you had seen all the Easter eggs I had eaten, you would be saying I was a hypocrite. But the key is to eat them all in one go. Don't be savoring them and hanging on to them for weeks and weeks. With sugar as well, the fluoride in the toothpaste does help kind of negate that. But a lot of people ask me, oh, well, if I eat 10 chocolate bars a day, can I just brush my teeth 10 times a day? It doesn't really work like that. It's all about the pH in your mouth. So really just limiting sugar to meal times. So breakfast, lunch, dinner, one snack, and keep anything sugary to those times. To be honest, it's difficult to avoid sugar. It's in so many things we eat. So just by being a bit aware of what you're having in between your meals can help. Also, not taking sugar in teas and coffees can be helpful. Try to only drink water as much as possible between meals. I always show people this next little picture because it can surprise people sometimes how the things that have hidden sugars in them. So we all know about the junk food, like cookies and ice cream and fizzy drinks and all that. We all expect that to have a lot of sugar in it, but it's the hidden sugar in seemingly healthy food. Things like yogurts, cereals, and sauces like ketchup has an awful lot of sugar in it. Fruit juices, things like that. Again, those things are healthy on their own, I suppose, but if they're introduced between meals as snacks, that's when they can start to cause trouble for your teeth. The most place I find that happens is with drinks, actually, more so than food, because if you're eating well at your meals, you shouldn't need to be snacking lots in between. But yeah, drinks, sugary drinks, and a lot of children I see coming in maybe with like squashes, my waddies, things like that. They do have enough sugar in them to cause trouble. So that's a little kind of a tip for how to avoid some cavities. I always look like a weirdo in the supermarket. I'm always checking food labels, and I'm still even shocked at how much sugar is added into foods. So I'm going to go on to this last slide here. So just takeaway points, what to remember about the dentist. And it sounds like that most of us here have chatted to the dentist about HHT, which is fantastic. So when you go to the dentist, if you or a family member have HHT, it's really important to tell the dentist. Don't assume that they know about it, because as far as my experience was, they probably won't know too much about it actually. So tell them that you have HHT or a family member has HHT. Be a good idea if you could, when you're calling to make the appointment, to mention it to the receptionist. The receptionists are well used to dealing with things like this. Say, I have HHT, I'll need to talk to the dentist about it. They'll probably give you a little bit extra longer of an appointment just to have time to talk about it, have time to make a plan, to organize a prescription for antibiotics if it's needed. Again, prevention is best. So you want to avoid having to visit the dentist any more than every 6 months. So if you can keep on top, good oral hygiene, good dietary habits, look after your teeth well, then at least you know that you're doing everything you can to avoid needing any dental treatment. So that's me for today. I'll just say, does anyone have any questions?
That's great. Thanks a million, Ciara.
Well,
We'll start again like we did the last time. I know I saw some questions popping up there in the chat. So Michael, are you okay to ask the first of those, please?
Yeah, funny, I have quite a few questions, although during the presentation, Ciara actually addressed half of them, so I still have 4. So the first one is, I have issues with HHT bleeding gums. What's the best way to handle these bleeds?
To be honest, soft toothbrush, definitely. Very, very soft toothbrush. If the gums are bleeding, make sure, I know it could be from HHT, but make sure that you're going to the dentist to check that it's not related to gum disease, as I was saying, and definitely really important to get very regular hygiene appointments, I would say, because that can help reduce bleeding in the gums as well. So in my presentation, I mentioned every 6 months, but with someone who has a problem with bleeding gums, your dentist might even recommend getting a clean every 3 or 4 months, possibly could be helpful. There are mouthwashes you see out there marketed towards bleeding gums, things like Corsidol, and you see it a lot on advertised on telly, but I don't recommend it for using every day. It's more like a medicine, I suppose. It stains your teeth if you use it all the time. So I would say soft toothbrush, an electric toothbrush, even if you wanted, with a very soft head on it. Don't be afraid to brush along the gums, brush them nice and gently, but brush along the gum line, and again, maybe more regular hygiene visits just to make sure that the bleeding isn't due to some gum inflammation as well as the HHT.
Brilliant. Okay. How should we treat severe bleeding in gums? Should they be lasered?
I'd say actually Dara might know more about that than I would be. If it's from telangiectasia, I think that the sclerotherapy possibly could be good for that, or laser. I'm not actually sure about the actual HHT treatment for it, okay. But I'll check and I'll get back to you on that if Dara doesn't know.
Brilliant, thank you. And Sharon asks, how does being iron deficient affect your dental health? So Sharon's continually having a mouthful of painful ulcers and a burning sensation in her mouth. Yes,
very common with anemia or with iron deficiency to get mouth ulcers. Unfortunately, if you're anemic, the mouth ulcers will develop. It's all about trying to reduce how long they last for and to manage the pain from them, because they can be very, very painful. The burning mouth is trickier to deal with, actually. For the mouth ulcers, what can be helpful is a steroid mouthwash, and you use it even when you don't have ulcers, but you increase the frequency when you do have ulcers. You do it up to 6 times a day when you have an ulcer. Unfortunately, due to the I don't know, silly dental council laws, a normal dentist like myself is not allowed to prescribe the steroid mouthwash because it's not licensed for use as a mouthwash. It's a little betamethasone tablet. The GP might be able to prescribe it, but otherwise a referral to the oral medicine department in Trinity College in the Dublin Dental Hospital, they'd be able to prescribe it there. My brother actually had a problem with very bad mouth ulcers, and he got a referral from me to the dental hospital, and these steroid mouthwashes really helped. So you hold it in your mouth for about 5 minutes 6 times a day. I know that sounds like a lot, but it drastically reduces how long the ulcers will actually last for.
Brilliant. Okay. And Benvenido asks, how do you stop a bleeding gum or tongue correctly? So there's 2 different things. There's the gum and there's the tongue.
Probably the best way, if it's a telangiectasia that has started to bleed, I would suggest getting a damp bit of bandage or gauze. Dampening it is really important. If you hold something dry on something that's bleeding, and then it'll stop bleeding, and then you take it away, you pull away the clot with it, and it will start to bleed again, and it seems like it's not stopping bleeding at all. So dampen a bit of cloth, bandage, and hold it on the area that's bleeding, and put as much pressure as you can on it for about 20 minutes or so, and that should actually stop it quite effectively. But it's really important. Most important thing is that what you're using is damp, just with a little bit of water. Maybe boil the kettle so it's nice and clean. Boil the kettle, let the water cool down, dampen a bit of bandage, and hold it on wherever is bleeding for 20 minutes. Lots of pressure, take it off, and the bleeding should have stopped then.
Okay, so interesting one. And Carol asked a question about if you have a telangiectasia on your tongue, which is throbbing, sore. Is there a particular solution that would relieve that in any way?
Hard to know with that one. I actually don't have it. I'm trying to think. It'd probably be to see, is there some sort of treatment that could be done on the telangiectasia to reduce it. But for some, I know anything on your tongue is super sensitive, so it can be very, very tender. Probably, I'm trying to think. There's a very good mouthwash called Difflam. It's Difflam, and it's very good for any sort of kind of painful ulcers, painful kind of lesions in your mouth. So that could provide relief, but it'll probably be only for a short time. So I suppose if it's really throbbing and at you, something like a anti-inflammatory or paracetamol may help, but it'd probably be to try and get that telangiectasia treated somehow to reduce it, I suppose.
Okay, thank you. And the last question is an easy one. Where did you say in Mayo you're actually from?
I'm from Kelchamaw, so home of the Culchies, in between Kelchamaw and Ball, out in the sticks. So.
Okay, look, thank you very much for your presentation. That's all the questions I have at the moment.
That's lovely. Thank you so much.
Dorothy, have one there.
Can I add one or two? We have some patients that talk about using a wet, cold tea bag when they have bleeding gums. Is it the tannin in the tea? What's the connection, or have you heard of tea bags?
I'd say it's probably the tannin in the tea, and tea can be kind of, I suppose, antiseptic, I suppose, in a way, and also just the fact that it's acting like that damp compress, you know, that I was talking about, that it's damp, but it's kind of just relieving it in that way, similar to, I suppose, the way a tea bag can be used for eye infections and stuff like that. So probably similar, but yeah, definitely, yeah, no harm anyway. So apart from for your iron, as Niamh was saying.
Yeah. And one other thing, I've had patients talk to me about having their children fitted for braces. Now, I know it's an orthodontist would look after all this rather than the dentist, but I even had an orthodontist refuse to treat my own child to put on braces because when he heard HHT, he thought, no, that he would have to inject the child with every visit with the antibiotic. Is this something you can tell us a little on, or should we be talking?
Absolutely. That shouldn't be the case. When you're getting orthodontic treatment, sometimes before you get the braces, you might need a few teeth taken out, and that's usually sent back to your general dentist like me. So what the dentist would do for the extractions, if needed, you would need antibiotic prophylaxis for that, but you shouldn't need antibiotic prophylaxis for every braces appointment because it's not invasive. So it shouldn't be, there shouldn't be a risk of it causing a bacteremia because you're just working on the surfaces, you're just sticking things onto the teeth, you're not going under the surface. I think every orthodontic appointment you shouldn't need an injection for, so that should reduce the risk of need for antibiotics. So no, I think probably if you're told no, then go to a different orthodontist.
That's what we did. That's what we did. Yeah.
Perfect.
Okay. Thanks for that, Ciara.
No problem. Thank you so much.
Presentation. Yeah.
That's good. Thank you.
That's great.